African American community for so long has been at the wrong end of health values and at the end of the numbers and the statistics. And so I think that as a pastor, it's part of what my ministry is to talk to people not just about their spiritual well-being, but also to make sure that our temples are healthy as well. Because we've come to learn and realize with people that if our temples are not healthy, then it's hard for us to be in service as well. Unfortunately, in East Austin, it's been known as a food desert for a long time, and so it's hard for people to get fresh fruits and vegetables. It's hard to get to a grocery store that you don't have to travel all the way across town. And so access and, like I said, diabetes and cardiovascular issues are some of our main concerns.
Well, as a nation, we are only as healthy as the individuals who make up our communities. And so if we have communities, in particular communities of color, women, people who are vulnerable, not able to access health care and health services and be able to address all the different things that keep them from being at their healthiest, then as a nation we really suffer. Physically, emotionally, economically, from every aspect. And so it really is in our best interest to care for our communities who may be more at a disadvantage or may have less access to resources, and make sure that we provide those trusting, tailored resources that really fit their needs, so that as a society, all of us can thrive.
Where's the greatest need, and how can we get in front of those folks and find out what works best for them to meet those needs, and then resource and empower them to execute better in their communities, right? And the solutions can be complicated sometimes. This one feels a lot less complicated to me because we're talking about monitoring your health and becoming accountable to team leaders and the people in the community that have agreed to obligate themselves to resource and track folks. Talking about fresh food and exercise and the impacts those things can have to bring that 20 years down to where it ought to be, which is zero, neutral. And we do live in a city now that I think is very focused on eliminating the line between the them and the us in every way.
Yeah, so one of the programs that we do at School of Nursing is the AMEN program, which is an African American mental health and wellness program that we've been doing for about 3 years. We're funded through Austin Public Health. And what we've learned throughout these 3 years, especially during COVID, is that there is no mental health without physical health and social health and spiritual health, and they really are integrated. And so even though our mission was to try to raise awareness and reduce the stigma around mental health, what we're finding is that we're really trying to address mental health in a really integrated, holistic way. And so, this men's health clinic is a perfect segue into the community from our faith-based mental health and wellness program to be able to offer services that can help men get on a pathway to health. And so we decided to partner with the American Heart Association to offer blood pressure screening, education, and referral to services. It's a nice fit for the Heart Association's outreach mission, and it also fits very well with the kinds of skills and resources that nursing tends to bring to the community. And because blood pressure is at the heart of all the different chronic conditions that people face, men in particular, we thought that if we can begin to just address blood pressure, which feels like a safer way to engage with the healthcare system, we can then also start to talk about their mental health and their other health needs and be able to connect them with the various services and agencies that could be helpful to them.
So what I love about the idea of partnering with the American Heart Association is that there's a long history of concern, of care, and also resources being provided to help people take better care of themselves. And so I believe that as the church, we partner with them because, number one, we are a trusted entity within the community. We are a voice that our community listens to. They trust us. And so therefore, if we embrace the importance of taking care of our health, my hope is, my prayer is that all the members of our church will also take it as a great concern and know that it has to be a partnership. As the announcements go out, people are starting to get engaged, are starting to be excited. Another partnership that we're doing with the American Heart Association. And then what I love about the interest is that we're also partnering with the AMEN program and with the UT School of Nursing. And so we've had a relationship with them for years, and it's another trusted partnership that allows our membership to know that it's not just your church, but it's the School of Nursing, and now we're bringing in another partner who has more knowledge, more expertise, and more resources to help us to take better care of our temples. And so I like the excitement that I'm seeing. I'm liking how it's becoming contagious, that we're doing some great things, and that it's beyond Mount Zion. We just want to be a catalyst for part of what's happening in all of East Austin.
You know, we were really excited at the School of Nursing to meet this empowered group of volunteers because our missions are so well aligned. And there's a lot of interest within the community to reach out and do some service and to provide education and support. And we have access to the community through our Amen program. And so by working together, we can bring more volunteers into the community space, introduce them to one another, create these new bridges and linkages and partnerships so that over time, faith-based communities and other people within the community will recognize American Heart Association as a known trusted resource that they can go directly to get information, education, support to address not only their heart health but other aspects of health as well.
I think we're going to see some momentum that has a little less to do with the science behind heart health and a little more to do with the heart that we refer to a different way. It's non-scientific. It's the heart of compassion and care and empathy and friendship building and that momentum that a bunch of good people getting together to talk about what could be, what that creates.
So for those persons who are attending the Heart Ball, what I think you can do is, number one, you can't miss out on giving to the American Heart Association. I would encourage you to contribute to them financially so they can continue to do the great work that they're doing. Number two, become an advocate in your neighborhood, in your community for good heart health and for partnership and collaboration among the faith community, among the American Heart Association, and with the UT School of Nursing, the Amen program. Do everything that you can to become an advocate for that. And then thirdly, maybe most importantly, I would even tell you, let's take some personal accountability for our own health. Let's make sure that we're exercising, we're eating well, and doing what we can to be a physical and personal example of what good health looks like. And so we know that everything is not under our control, but we ought to do the best we can with those things we can control. So.